Welcome back to another Pet Health Watch segment with Dr. John Kaya. And you brought a couple friends here with you.
I did.
Let's introduce our friends.
This is Ashley. She's a veterinary technician at our hospital. And this is Maddie, the star of the show.
And then remind us the hospital.
Hawaii Kai Veterinary Clinic.
Hawaii Kai
Yeah.
This is Maddie.
Maddie's 10 years old. Yeah, rescue, so give or take, a little bit. And she's here to help us talk about diabetes in cats.
Okay, so let's talk about diabetes in cats, because for those who are not, cat lovers or even familiar with cats and didn't realize that they also can fall susceptible to this disease.
Oh, yeah.
Most people know that humans can develop diabetes.
Yeah.
Many are surprised to learn cats can too. How common is diabetes in cats?
It's pretty common, actually. I would say, well, I take it back. 1 in 100, maybe 1 in 200, but it's becoming more common.
Really? Why is that?
Some of the risk factors, they're usually middle-aged, and obesity plays a role. So as our household cats get all the funny, the fun-loving treats and stuff, they get kind of chubbier, and it makes them prone to it.
Is there Ozempic for cats? And I'm only
Yeah.
but also I am curious. Is there?
Right now, no.
No.
But
okay.
I don't know, one day, I think.
No
one day.
GLP-1s for the cats?
Not yet, but it's coming. I think it's coming one day. Yeah.
Can you tell us about maybe early signs of diabetes that cat owners might notice at home?
I think the most common one is that the cat starts to drink more and pee more. Yeah. So that's the number one thing. People are saying, hey, my cat's drinking a lot, peeing a lot. What's happening is they're urinating sugar, glucose. And so because the sugar's there, it drags more water out of their body, and so they become more thirsty. So they drink and drink. They have a drinking problem. And I'm just joking.
No,
it's a dad joke. Anyways.
I love dad jokes. We can pepper them in throughout this entire segment.
Yeah, but they're also, they get a little more lethargic.
Okay.
And they're eating a lot, but they're not gaining weight. In fact, a lot of diabetic cats are losing weight.
Really?
Yeah, because they're peeing out the sugars.
Peeing out the sugars.
Yeah, their calories. Calories. Yeah. So, I wish I had that problem sometimes.
I would. Yeah. Wouldn't that be great
that
to
would
urinate your pounds away for humans? So if a cat is diagnosed with diabetes, what does treatment usually involve?
We mentioned obesity, right? So controlling the weight management. There's studies that show that higher protein levels and lower carbohydrate diets are good for them. All of those things. But inevitably, they're going to need insulin. Cats need insulin, yeah. So
shots.
Insulin
Is that
shots.
what you brought here?
That's what we brought here.
Oh my
goodness.
Is sweet little Maddie going to get an insulin shot?
Live on TV, she's going to get her treatment.
Oh, she's such a trooper.
Yeah.
You're so sweet.
We wanted to have you do it because, to show how easy it is for just anyone, but
While I would love to.
But I think they're leaving it to the medical professionals.
Yes, I did not go to school for this. God forbid if something bad happened to Maddie, I would never forgive
She's
myself.
doing really well here.
You know what? She is quite comfortable.
She's very comfortable.
I think we need a house cat at KHON.
I think so, and I think it's her.
So you mentioned something really quick before we do the show. You mentioned obesity in cats. For cat owners, what would be considered an obese cat in terms of
their weight and all that? Yeah, I think it's more just kind of more eyeballing it. Yeah, so it's not like a 10-pound cat is overweight or a 15-pound cat. It could be, based on their size, 15 pounds might be okay, for an example. But what we do is we kind of look at them, we feel their ribs, we check their belly, and we make a determination of how heavy they are. And she's a little heavy, but it's okay. It's okay.
I don't see that.
You don't see it?
More to love.
Yeah, more to love.
She's curvy.
Yeah.
Okay, so Maddie.
Yes.
She's going to get the shot?
She's going to get the shot.
So do shots have to happen for cats every...
in general, twice a day.
Twice a day? Okay.
Sometimes once a day. It kind of depends.
So is this her first shot of the day? Or
it was this morning she had her first shot. This is her second. Yeah.
All right.
She gets 4 units.
Okay, I hope she's not afraid of needles.
No, I think she's fine. It's amazing how quickly they get used to it.
Oh, okay.
You're okay with needles, right? You're okay?
Sure.
Okay. Main thing, I don't poke my assistant here. Sorry, I gotta. So what we tell owners to do is lift their skin a little, like this, And then there's like a little, you don't want to poke their muscles or anything. You can just get under the skin. So I'm just lifting the skin. I'm not sure if the camera can see this. I'll move to the side a little.
Can the camera see this?
And it's a tiny needle, you know, almost like a mosquito bite type
That
of thing.
is quite a small needle. Oh, there we go.
Yep.
Okay.
And then I'm going to go right into the skin like this. And then I'm going to put in the insulin. And I'm going to take it out. And that's it.
That was it.
That was it.
I was more scared than Maddie.
Yeah. She did wonderful. She gets it twice a day.
Great job.
She's happy, yeah.
She's happy.
And Ashley's job is to make sure she doesn't run away, so she's doing a good job.
And diabetes in
Yeah.
cats, is this a lifelong condition?
You know, some cats go into remission, by the way.
Okay.
Yeah, so they get diabetes and they can slowly come off the insulin, believe it or not.
Oh.
Yeah, some
that's
can.
great.
In fact, her housemate, Mama cat had diabetes, and Mama was able to come off the insulin.
Wow.
Yeah, so it's possible. But even if they don't, and it's not possible, they can live really good, long lives, you know, with the proper treatment. Yeah.
Dr. Kaya, thank you for sharing your expertise with us and
Yeah.
bringing our new friends, Ashley and Maddie. This is a really good reminder that our pets can develop many of the same health conditions that humans do, and knowing what to look for can help them live longer, healthier lives.
Yes.
We appreciate it. Thanks, guys, for coming in.
You're welcome.